Welcome to the Jack Westin MCAT Podcast with your host, Phil Hawkins.
And Azaii Calderón Muñiz. Welcome to another episode of the Jack Westin MCAT Podcast. Do not freak out. Do not get nervous. We are going to break down the nervous system today, and we're going to make it simple because that's what we love doing here at Jack Westin. We are going to do things a little bit different today. Phil, do you want to tell us what we're doing differently today?
Yeah. So there are times here in the podcast that there are things that we want to dive into that we feel like you kind of need an image to explain this, right? Like certain things, like the right hand rule. Like, how do you explain the right hand rules without being able to see somebody's hand? And that's not really the way the format, podcast format mostly goes. We do notice that some of you guys watch the video forms. And so we're going to try some stuff out. We're kind of like shaking things up a little bit. We're going to be doing the podcast today with a lot of images, which is something we've never done before. This also is really beneficial because we have a bunch of really great images. I know Taylor, when he was on the podcast, he talked about this, about how like there are companies that have come and like tried to purchase our images to use for like drug companies to like explain stuff to their consumers and stuff. And so we have like fantastic illustrators that kind of help us explain topics better. And like in the podcast, we're like, oh, we really want to use images. And like, we have great images. And so we decided we're going to shake things up a little bit. Definitely let us know in the comments if you like will never actually like watch the video version of this, in which case like maybe this is not the thing that we should be doing. But in the effort to try to explain some stuff that's a little bit more complex, we feel like, upgrading the system, like adding a visual component might make things a little bit better.
From a podcast to a vlogcast.
Yeah, a vlogcast. Is that?
Yeah, I think it is a vlogcast for folks that do video and podcast. But yeah, we've definitely struggled with this because we want to give you guys the best of what we can. And so having that opportunity, we suspect will enhance your experience. And so we'll also try and make sure that there are components that if you are listening, right, you can get something out of it, but then you head over when you have time and you watch the video. And so that can be a good way to also reinforce the material. So if you're out for a run, you can listen when you get home, right, or when you're studying for the MCAT, watch the video and kind of cement what we've been talking about.
Yeah, this also allows us, just full disclosure, we're thinking about doing some stuff with like data interpretation and being able to show graphs and charts and figures and like figuring out how to interpret these things, because that's one of the big challenges on the MCAT. That's not something we can do without having a visual component. So I'm excited to try this out and just kind of see how it works.
Yeah. So with that, we're just going to dive right in. And because we're doing things a little different, I will kind of keep us on track. But yeah, so today we're going to start with the nervous system, like we said. And we really want to give you a broad overview first, because we're going to focus on one particular part of the nervous system, but you do have to know the different branches for the MCAT. And so there are two primary branches in which you can divide the entire nervous system. And so the first is going to be the central nervous system, and the second is going to be the peripheral nervous system. So the central nervous system, I think, is the one that most people are very comfortable with, right? The primary components being the brain and the spinal cord. And so the brain, we know, is going to process a lot of this higher order thinking, but it's also going to control aspects that are not within conscious control, like heart rate, right? Sleep cycle, emotions, learning, memory. And so what the brain does is it takes the information from the peripheral nervous system and it acts on it. Right. And so as the peripheral nervous system sends the brain information, the brain then sends information out, which is mediated through the spinal cord. And so the spinal cord is going to control that as well as reflexes. And sometimes there are reflexes that even bypass the brain. And so the spinal cord has a lot of power, so to speak, because even if the different parts of the brain are still functioning correctly, at the level of the spinal cord, we might have things that cause problems with our peripheral nervous system and cause diseases and disorders that affect people's daily life.
Yeah. So this is actually just kind of like taking a second and stepping back. This is really important for neurologists. This is really important for physicians to understand, not just like understanding this overall, how it works, but also like the way things work in treatments, because our central and our nervous system are actually like kind of different. You may have even heard from us at some point saying neurons don't regenerate, but like that's not strictly true. Like, it turns out that the central nervous system, like you damage those neurons, you cut them, there's not a lot you can do. But the peripheral nervous system actually has some limited regenerative ability. And so, like, there was this famous case of, there was a kid who was swimming on a beach and a shark bit his arm off, like gone. And like the uncle, who was like gotta be in the running for the world's greatest uncle, jumped in the water, pulled the shark out of the water, killed the shark, got the arm, and took the kid in the arm to the hospital. And they reattached the arm. And so the arm was able to have some like ability to like grasp things and stuff like that. And if you think about that, like cutting off an arm, you cut the neurons that go to the hands and stuff like that. And so in order to be able to reattach that and like have that hand function, like you must have healed those neurons. And that's possible for those peripheral neurons. And so it's really important for us to understand when something's central versus peripheral, because like there's some different like things you can do as a physician to address that. There's also different just diseases that target like specifically the central nervous system or the peripheral nervous system. In general, I mean, if I had to have one of those, I want one that targets my peripheral nervous system, which is like going to be a little bit more healy, to make up a word. It's going to be able to regenerate a little bit. And so that's definitely a better thing overall.
Yeah. And here's the really interesting thing. When you get to, because y'all are all going to be physicians, right? So we like to prep you for not just for the MCAT, but also thinking ahead. When you are working with a neurologist in the future in a couple of years, you need to know what's affected for each illness, right? And so one of the most common things that you'll see, in addition to maybe some of you folks having experienced this, is carpal tunnel syndrome. And so full disclosure, I'm someone that developed it very early on, so a couple of years ago. And I actually had nerve damage before I had the surgery, and it was essentially constant at that point. And I had the surgery, and I have like now I'm able to, do our sessions, the workshops, the free trial sessions, the office hours that we do without being in constant pain. And so the peripheral nervous system can really bounce back. Also have seen patients who have had nerves in their arms trapped, and they get surgery and they can regain use, like you were saying, Phil. And so understanding what's affected is super important as you move forward in your career.
Yeah. I also like that you talked about the reflex arcs, that some don't even go to your brain. Like there is a tendon in your knee that if you stretch it, like if you bend your knee too much, your body will extend your leg to like stop your knee from bending too much, because it's like a protection thing. Like if you bend your knee too much, you might like tear those ligaments, and like that's not good. And so the ability to like that reflex arc, that knee jerk, is actually what we test as physicians when you do that like hammer thing and you tap somebody's knee and then their leg kicks. That is like a peripheral neuron going back to the spine, and then a motor neuron coming back out that's a peripheral neuron that makes you kick your leg. That signal actually doesn't go to the brain at all. And so you can think about systems where, like, imagine a patient comes in and they can't move their leg, like their leg is paralyzed. And so you do this tap thing. If you can tap their knee and their knee kicks, that means the motor neuron from the spinal cord to the leg is working. And so the problem must be getting the signal from the brain down to that neuron. So in that case, that's a central nervous system issue, which is bad, right? Because those don't heal very well. On the other hand, if you tap that person's knee and their leg didn't kick, then the problem might be that motor neuron going from the spine to the muscle in your leg, which is a peripheral neuron. And so if you tap that knee and it doesn't kick when somebody's paralyzed, that's actually kind of a good sign, because it seems like that might be more of a peripheral issue than a central issue. And so I there's a whole lot of stuff going on here. And I just want to like really reiterate that, yes, this is stuff that the MCAT is going to test, but it's also like really useful to kind of like understand diseases and disorders and treatments that you have available to you as a physician later on.
Absolutely. And for future reference, never stand in front of a patient when you're doing, when you're testing their knee reflexes. Just, yes, personal experience, but never do that no matter how young and small they might be, thinking pediatrics. Mm-hmm. So we've talked about the peripheral nervous system, but we haven't told you what branches there are in the peripheral nervous system. And there are two primary branches. There's the somatic nervous system and the autonomic nervous system. And so the somatic nervous system is, right, this connection of motor neurons, like we've been talking about, but these are the ones under voluntary control. So those are the ones that allow us to talk with our hands during the podcast, move around, right? These are the ones that allow you to do all the things that you're accustomed to doing. Whereas the autonomic nervous system is going to control these involuntary responses. And so you can't make your intestines digest any faster, right? Some of us wish we could, but you can't. And so that's under the control of the autonomic nervous system. And even then, there are more branches. And so
I like that idea of it being perfectly under control. Like I'm like sweat, blush, right? Like forcing myself to blush and forcing myself to sweat, right? Like that's a little bit, I feel like you could maybe make yourself blush if you just imagined something embarrassing. But even then, like you're not actually controlling the blushing, you're just controlling your thoughts, which cause a subconscious or involuntary response afterwards.
Exactly. Unless you're like me and you're always like smiling a lot, then your cheeks may, there's a lot of heat being generated by your muscles. But yeah, there are a lot of things that we just can't control. And so to be very clear, there are things we can't control in this that are controlled by the central nervous system. But here we're going to be talking about things that we can't control that are in a part of the peripheral nervous system. Now, just to mention it, and we're not going to go into this, we have motor neurons and sensory neurons, right? The ones that are involved in actual movement, motor neurons, and sensation, sensory neurons. So back to the autonomic nervous system. Now, within the things we can't control, there are two main responses that our body needs to be able to have to environmental stimuli. So the first is going to be, and I'm going to go a little out of order from the image here, is the parasympathetic division, right? The parasympathetic nervous system. And this is the one where you're just relaxed, you're listening to the podcast, you're not out running, right? But you're just making some dinner. And this is going to be your rest and digest response. And so this is, if you think about it, right, when we talked about our metabolism and our intestines digesting a little faster, this is going to be the division that controls that. On the other hand, we have the sympathetic division, the sympathetic nervous system. This is going to be when you see a bear. This is going to be when you first sit down to take the MCAT or a practice exam, and you're like, oh my gosh, this is real, right? This is our fight or flight response. And there are people that are, they're going to have a lower threshold for this flight or fight response. And so we're going to talk about what happens at different parts of the body when these different divisions of the autonomic nervous system are activated.
Yeah. So just to recap, there's a lot of stuff in the central nervous system. You do need to know about the different lobes of the brain for the psychology section. You do need to know about, the like skeletal muscle stuff and the voluntary movement. But we're going to focus on the autonomics because I feel like this is an area where students get tripped up a little bit. Also, just as a side note, the nervous system is one of those areas that I think is one of the highest yield areas because it shows up in every science section of the exam. Obviously, nervous system has a lot of biology stuff going on, but obviously a lot of psych as well. Like understanding what's going on with stress, what's going on with emotions, what's going on with like psychological disorders. But there's also a big component here related to chemistry with like neurotransmitters, but also physics with like the voltage gated membranes and like what's going on as the charge builds up on either side of a neuron, which kind of act like circuits in our body. And so there's things to connect to that as well. So like when it comes to, for example, like the kidney, I don't think you're going to see a lot of big questions about the kidney in the psychology section, but you're going to get a lot more neuro questions. And so as a result, neuro is one of those areas you want to spend a little bit more time on.
Absolutely. So very quick side note, because I think a lot of times, we try and bring this point home to you guys throughout the podcast. A lot of times students feel like, okay, the MCAT is this isolated exam that I need to take. I won't actually need to know it for my future career. That's false. So yes, you are going to use this information in your preclinical year, meaning when you are learning the basic biology, the basic way that the different organ systems work. You will also use this in your clinical year, meaning when you are seeing patients when you are in the hospital. Very quickly, 7 a.m. yesterday morning, we had a meeting with our surgery clerk, the surgery director, so chief of surgery in the hospital, meaning in charge of all the surgeons. And guess what topics came up? We talked about the placement of certain items. I'm not going to go into details during surgery. And the reason that we use that is the distribution of pressure, right? The distribution of force across an area. So we talked about physics. And yes, we were getting quizzed on this. We talked about the kidneys and we talked about the movement of potassium and sodium and proton ions. Yeah. At the level of where in the nephron is this happening? We talked about calcium levels and the relationship with parathyroid hormone, which we have talked about in a previous episode here. So the information that we cover here is going to be useful throughout your entire career. This nervous system, like you said, neurologists use it on a daily basis. So really use when you're listening to the podcast, when you're studying for the MCAT, as an opportunity to prepare yourself for ahead of time and get a head start. Yeah. Now with that,
that's something I didn't expect us to go into, but I do want to share. I know that we have two people that I've worked pretty closely with that just started med school. One of them is Easton. If some of you guys have been to some of the free trial sessions, he hosts a lot of them, especially over this last summer. And he's told me that every single week of med school, something he's learned from the free trial sessions has come up. And he's been able to answer questions and get points. And like the teachers think he's smart. He's like, really, I just go to the sessions. And like, that's what I'm doing here. That's why I knew that like ethanol, like booze, is the way to treat somebody if they have methanol poisoning. You just get them really drunk, get them loaded. That's the treatment for this. And that's one of the things that we talked about in the free trial sessions. So yeah. So we're going to dive into the sympathetic nervous system here. One more thing is when you said don't get nervous at the beginning, like for introing this session, I thought you were going to say something about like getting scared and running away and like the fight or flight system activating. But yeah, so we're going to talk a lot more about these.
Mm-hmm. So moving on.
Yeah. The one thing that I think is important for this, I think a lot of students try to just memorize everything that the sympathetic system does and everything that the parasympathetic system does. And that is not a good use of your time.
Nope.
Because there are dozens of things. This is like an abbreviated list here. And there's a lot of other things going on. And even if you did try to memorize all the big long list of stuff, the MCAT could still throw a curveball at you on the day of your test, like trying to get you to figure out like, oh, okay, what's going on in this scenario. So rather than like, you do need to know this, right? And so some of you guys might be having some cognitive dissonance here. It's like, wait a minute, Phil is saying I need to know this, but he's saying don't memorize this. I'm like, that seems counterintuitive. It's really important to think about the scenario, right? Think about when your sympathetic, your fight or flight system is activated. Think about when your rest and digest, your parasympathetic system is activated. And what would you expect to happen in those cases? Like, when do you need to get more blood to your arms and legs for running and kicking and fighting, right? When do you need to get your eyes to dilate so you can see better? right? When do you need to like slow down your breathing? When do you need to speed up your breathing? When you're running and fighting a bear, or when you're taking a nap on the couch? And a lot of these just make sense if you just take a second and kind of like stop and think about these. And I really encourage you to like figure out, understand the scenarios that would lead to the sympathetic versus parasympathetic, and then utilize that information to like figure out like, oh, this long list of stuff has to be sympathetic. And then if they throw a curveball at you, like, well, that would happen when I'm fighting a bear, not when I'm taking a nap, right? And like that should just make sense overall.
Understanding the reasoning, understanding the underlying principles for why things happen in chemistry, in physics, and especially in biochem will serve you really well in the future. Because yes, you could sit down and memorize a bunch of facts when you're in medical school. That's not going to help you be the best doctor, the best physician you can be. And so, you might be thinking, okay, well, you guys just said this is intuitive. Why are you doing a whole episode on it? Because we want to work you through how you can learn this rather than how you can just memorize this. So thinking about when you're taking a nap on the couch, or maybe you've just had a really big meal and you are getting ready to take a nap on the couch. Do you need to have your eyes dilated to look for oncoming threats? No, right? So your eyes, your pupils specifically, I shouldn't say your eyes, your pupils are going to constrict because you don't sense a threat. Exactly. They're going to get smaller. You don't need to sense a threat, right? But now you just had this really big meal. And so we're like Pavlov's dog, right? And we're going to start salivating. And from our discussion of the digestive system in the past, we know that this is going to help break down, for example, carbohydrates, right? And start the digestive process. So we already can think about, okay, digestion, right? The stomach is also going to be more activated and stimulate digestion. Why? You just had a big meal, but also if you're just getting ready to take a nap on the couch, or if you're just, reading and passively listening to the podcast, the body says, I have the reserve, I have the energy reserve to do these things. There's nothing else that's vying for my attention. Same thing with your intestines, right? Part of your digestive system. Hence the digest part of rest and digest.
Yeah, I think, once again, this is something that should make sense, right? When you're napping, you should be breathing less, your heart should be slower, you should be sending a lot of blood to your intestines to like absorb nutrients and help you digest food, but you should not be sending a lot of blood to your arms and legs. It's actually kind of interesting. A lot of times students try to memorize like parasympathetic. Is that vasoconstrict or vasodilate? And like, it's like depends on where you're talking about.
Exactly.
Right. Yeah, it like vasoconstricts to send less blood to your arms, but it vasodilates to send more blood to your intestines. And obviously the sympathetic system is going to be just the reverse of this. The pupil thing, I think that sometimes gets students a little bit. Your pupils dilate so that you can get more light from more angles coming into your eyes. You can actually see better when your pupils are dilated. You can see more. And that's something that you need if you're like, imagine you're in the middle of a battlefield, right? Like, like in World War II in the trenches, right? Like you can bet everyone's pupils in that line, super dilated because they're all afraid and they got the fight or flight thing kind of going on. But also your heart beats faster. Something that's not on this list, but it's something that I know the MCAT has tested before, but think about like temperature regulation. Right. So when you see a bear, right, or when you're in battle, all of a sudden your heart's going to kick up, right, to like get more blood to your arms and legs for running and punching and kicking. It's also going to increase your metabolism to send more glucose out to your muscles so that they can run and punch and kick. And that's going to produce heat. So you're going to start to get warmer as you go into this, like your temperature actually goes up. It's kind of an interesting thing. Like if you show scary pictures to somebody, their temperature will actually notably rise. And this is something you can kind of like see in pictures and stuff. And so part of the sympathetic nervous system is dealing with this increase in temperature. So it'll also send more blood to your skin. and that will cause your skin to get a little bit redder because you got more blood going to it. And it'll also make you sweat more because that helps you cool off. And the more blood to your skin also helps you cool off. And this is why when you get nervous, sometimes you might blush because your face is getting redder. Note the fight or flight doesn't have to be like running and like kicking bears and stuff like that. It could also be like my crush just sat next to me and all of a sudden my heart rate's going a lot faster and I'm starting to blush and I'm starting to sweat, which is not attractive. And like that sort of thing will sometimes kick in. Also, like think about like scary stuff can invoke a cold sweat where like you see something scary and your heart rate's beating and all of a sudden you're sweating like from fear. And it's not actually the fear that's making you sweat. It's your sympathetic nervous system, which is being activated by the fear that's causing you to sweat, to start to deal with this. And so a lot of these like responses that our bodies have to all of these environments are things that actually do make sense if you understand kind of why and like what's going on with these things. And that's something I really want to encourage you guys to think about, right? Like, when do I need to sweat? When I'm napping or when I'm fighting, right? When do I need to have a higher heart rate? When do I need to increase my blood glucose level, right? Like, well, when you're running and like you need more glucose sent to your arms and legs.
Yeah, I do want to pause and recognize, because we said in rest and digest, right, there is an increase in your metabolism in the sense that you're digesting more efficiently.
Right.
With the liver, right? So when you have that rest and digest, when the parasympathetic nervous system is more active than the sympathetic nervous system, the liver's still active, but what it's doing is different, right? Mm-hmm. So the liver produces bile. It's going to stimulate that bile release. What it does when the sympathetic nervous system takes over in terms of signaling, it's going to release glucose, right? So the liver is doing something in both cases, and it's active in both cases, but differently. So when we talk about increased metabolism or increased digestion in the parasympathetic nervous system, we're talking holistically. Whereas when we say that increased metabolism in the sympathetic nervous system and that fight or flight, we're talking about the liver and glucose metabolism specifically.
Right. Not only that, but also like the rate of glycolysis in your muscles.
Yes.
Like that's going to go up when you're like running and kicking and stuff because you need more ATP for that. But like if we're talking about, you know, kind of actually like breaking down food like for fuel, like that's a little bit different, right? Like that's a little bit different than my muscle cells becoming very active. And so there are some cells like in your intestines that they will get more active under parasympathetic systems, but like the muscle cells in my arms and legs, they will get more active during sympathetic. And so to like say like just generally metabolism, I think it's something like we're both right, but we're talking about different cells here, and like which cells are specifically becoming active depend on like, once again, what makes sense. And this is why you have to be really careful, because students will try to memorize like vasodilate is sympathetic and metabolism is sympathetic, but like it kind of depends on the context. If you have a passage about the metabolic activity of a cell in the jejunum, which is part of your small intestine, parasympathetic should make that more active. Sympathetic should make it less active, but that's the opposite of a muscle cell in your tricep, which should be flipped.
And when you're thinking about vasodilation versus vasoconstriction, think of what is active. What is active will need more blood flow. So that's going to, the blood vessels that perfuse or provide blood to those organs are going to vasodilate, whereas the ones that become less active are going to vasoconstrict. Now, we've talked about muscles in the sense of like your arms and your legs, but remember that your intestines, for example, have smooth muscle, right? And so that's where, when we were talking about sensory motor neurons in the sympathetic and parasympathetic nervous system, we mentioned them offhandedly, but they're still playing a role here. And so you want to think about also, if they ask about whether the muscles are activated or not, think about what organs they're talking about as well.
Yeah, that's one of those things that can be really tricky if you're
Yep.
reading a passage. Like, you need to be clear. Did they say that you're talking about the arterial leading to the bicep or an arterial leading to the colon, right? Because whether that's going to vasoconstrict or dilate depends on the scenario. It's actually really interesting how that works. Actually, those arteries have different receptors on those like smooth muscle cells. And so like sympathetic system will activate some of them, but parasympathetics will activate some of them. And so like those cells actually have slightly different receptors, the arteries of your so if you took an artery from your small intestine and use that to replace an artery in your arm, right? That artery from your small intestine might actually vasoconstrict when it should dilate, or dilate when it constricts after you have made that switch, because the muscle cells the smooth muscle cells in your digestive system the smooth muscle cells of the arterials in the digestive system are different than the ones in your arms and legs. And so it's super interesting trying to understand how these things kind of fit together. One thing that's kind of important here is, pretty much as is always the case, a lot of people try to paint something with one big brush and like, it's this way. And like, that's just how they want you to remember it for their level of understanding, right? Like, I admitted earlier today that I have told students neurons don't regenerate, but the peripheral neurons are a little, like, they have some limited regenerative ability. But like a lot of times we just say stuff because it simplifies things. And so there are some things here that are actually a little bit more complex that we want to talk about. One of them, we keep saying sympathetic and parasympathetic system. A lot of people will say that your parasympathetic system is acetylcholine and your sympathetic system is epinephrine and norepinephrine. And that is true for the most part, but there's some like nuance to this that makes it a little bit tricky. Just a note on epinephrine and norepinephrine. Those are the molecules released in the sympathetic, at the end of the sympathetic nervous system, to cause like the muscles to dilate or constrict or to make you sweat or whatever. Those hormones, or those neurotransmitters being released from the neurons, those are also hormones. And so those things are not mutually exclusive. So like your adrenal gland is a gland. It's an endocrine organ. It will release epinephrine and norepinephrine into the bloodstream. And so they'll go around and activate stuff like from your fight or flight system, just like your neurons that'll go down and release epinephrine and norepinephrine. And so there's some trickiness there that like epi and norepi are hormones, but they're also neurotransmitters. The other thing is they're released from the adrenal gland. And so when we first started to kind of understand this epi and norepi, just a shorter way to say it, basically we noticed that like, oh, if we like stick a needle in somebody's adrenal gland, suck it out, and then stab it into somebody else, don't do this. But if you did do this, all of a sudden their sympathetic nervous system kicks in because you just sucked a bunch of epi and norepi and gave it into somebody else. They didn't know that's what the molecules were. They just knew it was something here in the adrenal gland. So they called it adrenaline. And so you have probably used this term all the time, right? Like my adrenaline's pumping. Like technically it's epinephrine and norepinephrine. I don't know about you, Azaii, but my neuro teacher straight up said, if I hear anyone use the word adrenaline, they're automatically failing, right? Because adrenaline is not a thing. It's epinephrine and norepinephrine. And like, so now every time I say the word adrenaline, my sympathetic nervous system kicks in. I start to get nervous and sweat. Like, did he hear me say it? Because he's gonna fail me, even though it was like a decade ago. And so that's something to keep in mind. The MCAT may use the term adrenaline, or other people may use the term adrenaline. Same thing. Epinephrine, norepinephrine, that's causing this fight or flight response.
And if they're talking about norepinephrine, they might say noradrenaline. I did not have anyone put down the hammer that aggressively, but maybe that's just because at some point you just kind of switch to epinephrine and norepinephrine. But before we go on to the next slide and start kind of describe where these are really being released, I want to pause really quickly and I want to challenge you guys to think about something that's not on this slide, and that's the kidneys, right? And so we already talked about how the adrenal medulla, right, the glands that sit atop roughly atop the kidneys, are involved in when they release epinephrine and norepinephrine in the sympathetic nervous system. We don't have it up here, but think about what the kidneys themselves would be doing in terms of urine production, right? So the bladder is what stores the urine. So in the parasympathetic nervous system, it's going to contract. In the sympathetic nervous system, well, sometimes you feel that need to just go pee. And if you completely lose control, you may actually. But if you think about the kidneys themselves, you don't want to be doing a ton of urine production, right? And making it when you're running from a bear, when you are sitting down and using and doing the MCAT. And so even though it's not on here, think about what would happen in other organ systems and in other organs themselves when you have this parasympathetic versus sympathetic overtake, because it's a conversation between the two, right? It's not like your parasympathetic nervous system fully shuts down when your sympathetic nervous system is signaling.
Yeah, it's that balance between the two.
So
just one other thing kind of on this as well is like, we're talking about this is how things work, but like you might give somebody epinephrine or give somebody norepinephrine as a treatment, right? And like that's actually pretty common. Like EpiPens, I'm sure you guys have heard of EpiPens at some point. It's just a little pen syringe filled with epinephrine, and you can like stab it into somebody's leg. And what's interesting there is like, when are the scenarios that you do that? Like if somebody's having an asthma attack, right, and they're having like all of a sudden like or an allergic reaction, and their bronchioles are being kind of like inflamed to the point where they can't breathe, right? So you give somebody epinephrine, their fight or flight response kicks in, which makes them like open up their airways and their heart beats faster, and like that makes it like all of a sudden easier for them to breathe. And so like an EpiPen can save somebody's life, just giving them a little bit of epinephrine. Another case where you might see this, you may not have seen this in person, but you might have seen this on like TV, where like their heart is like stopping or not beating correctly. And so you'll say, give them a shot of Epi. And so like giving them that epinephrine makes the heart beat harder and faster. And that's something that is useful if someone's heart is not beating properly. And so you can just give them a shot at Epi, which will make their heart maybe fall back into rhythm or start beating when it wasn't beating a moment ago. And so that's also a really common thing. And you see epinephrine in crash carts, which is, if somebody's crashing and it's a code blue, like you go get some epinephrine. That's one of the things you want to do in that case.
Yeah. Every time this comes up in our conversations, I get really curious about what medical shows students watch.
Yeah.
Folks that watch Grey's Anatomy versus I grew up watching like My Life in the ER, which I should not have been allowed to watch. But also, like you mentioned, like a couple of times ago, or a couple of podcasts ago, Scrubs versus Chicago Med has been a guilty pleasure for me every so often. And it's actually kind of fun once you're in medical school because you can figure out how accurate they are, or they'll be talking about something, you're like, I know what you're talking about. But it's a guilty pleasure. But I always wonder like what people watch. If you are watching this on a platform that lets you comment, I personally selfishly would love to know if you've watched any and what you've watched.
Which ones? I'll admit I am a Scrubs fan, like huge. I also really liked House. House was not very realistic.
No.
But I remember watching a bunch of physicians break down and vote on like they were watching scenes from different shows on which one they thought was the most accurate. And Scrubs won, which was weird because there's all sorts of like zany, wacky stuff that happens, but it's always like between like the actors or in the actors' heads. Like the actual medicine itself is really accurate, which is kind of interesting.
Yeah. So back to epinephrine and norepinephrine, and moving forward. So we can talk about the different neurons. So the chains of neurons that are a part of these systems. So moving on to the next slide, we'll see the parasympathetic versus the sympathetic nervous system. And so just because we talked about the parasympathetic nervous system first last time, we'll continue on the parasympathetic nervous system. But like you were saying, Phil, a lot of times people want to just say a blanket statement of X, nervous system is acetylcholine. The other one, Y is automatically epinephrine, norepinephrine. But the reality is that acetylcholine, before the organs themselves are targeted, right, going from the central nervous system and synapsing or connecting at the level of the ganglion, just a collection of neurons, both are going to release acetylcholine, right? They're getting that started, that first neurotransmitter.
Yeah, so that's weird, right? So like acetylcholine is actually a part of both systems. And there's a preganglionic neuron and a postganglionic neuron. A ganglion is when they kind of like synapse and kind of go through this. Now, I want to be kind of clear, like, especially if we go back to this image here, you can see all of these signals are coming from the brain. And so that preganglionic neuron is actually a central nervous like neuron. And the postganglionic neuron is a peripheral nervous system. And so like if we go back up to this image here, we can see that we kind of like simplified here a little bit that technically parts of your autonomic nervous system are being activated from your brain. And so it's just those preganglionic neurons are actually central nervous system. The postganglionic are peripheral. Now, the preganglionic neurons from both parasympathetic and sympathetic, the preganglionic ones, both release acetylcholine, and that causes the next neuron to release their neurotransmitter. Note that every neuron releases like one type of neurotransmitter. A neuron that releases acetylcholine is not going to release dopamine or serotonin or epinephrine, right? It just releases the one that is its thing. So the preganglionic neurons just release acetylcholine, and they'll activate the next neurons. The next neurons in the sympathetic system, that postganglionic neuron releases epinephrine and norepinephrine. The parasympathetic one releases acetylcholine. I do want to clarify, epi and norepi are really similar molecules. Like, so you might actually have a neuron that releases both of them, and just like some of them have been modified to norepi, but not all of them. And so that thing that I just said, each one releases one, that was also a little bit of a simplification for kind of understanding that. But like dopamine is way different than serotonin, which is way different than acetylcholine. And so you won't have one neuron that releases both of those. And so this is a really tricky thing for a lot of students because students have learned epi is sympathetic and acetylcholine is parasympathetic, and that's not actually true.
Mm-hmm. Now, really quickly, you'll notice on this image that it says soma, so don't get confused. Soma is just the cell body. But what you'll notice is that the preganglionic neuron in the parasympathetic nervous system is longer here, whereas it's shorter in the sympathetic nervous system. And then they kind of switch in the postganglionic neurons. Now, when we say ganglion, right, like we said, it's just this collection of neurons where they them synapsing together. This should then make sense because the parasympathetic nervous system is going to synapse closer to the organ that it's innervating, whereas the sympathetic nervous system, it's going to do it at the level of the spinal cord. And so the parasympathetic nervous system really is just acetylcholine, right, for the most part. So that preganglionic neuron is going to release acetylcholine. That postganglionic neuron is going to release acetylcholine. They can also release nitric oxide, and so nitric oxide controlling vasodilation, vasoconstriction, but primarily you're going to see it associated with acetylcholine, especially for the purposes of the MCAT.
Yeah. Another reason to kind of think about this, right, like these like long and short pre and post ganglionic neurons. I know some of you guys are thinking like, why is this important? Why are you guys spending so much time on this? It's actually pretty important. So first off, in the sympathetic system, that preganglionic neuron goes to like somewhere in the spinal cord and then releases acetylcholine onto the postganglionic neuron, which will then go to like the heart, or will go to the lungs or the skin or whatever. And so that place where you're reaching or releasing acetylcholine is actually very far away from the heart. So when that neuron goes to the heart and releases epinephrine and norepinephrine, there's no acetylcholine in the area. Versus the parasympathetic, if it's like goes all the way from the brain all the way to the heart, then there's a ganglion that releases acetylcholine onto the postganglionic neuron, which is really short, and that just goes to the heart. Like you're releasing acetylcholine kind of twice in that region, but it's not a big deal because you kind of want to be releasing acetylcholine anyway. The other thing to note is that like what we talked about before with central nervous system and peripheral. So technically those preganglionic neurons are central nervous system. And so there's a neuron that goes from your brain all the way to your heart that is a preganglionic neuron. So it's a central nervous system neuron. That is a parasympathetic neuron. So if you damage that neuron, that's probably not going to come back. Versus the sympathetic nervous system, that goes down in the spinal cord, synapses, and then you have a postganglionic neuron, which is peripheral nervous system, that goes from the spinal cord to the heart. You damage that neuron, that one could regenerate. That one could come back in certain cases. And so there's like, if you cut the neurons between the spinal cord and the heart, like if you cut the parasympathetic one, you're cutting a central nervous system neuron. That's not coming back. You cut a sympathetic one, that's a peripheral one, that has some limited regenerative ability. And so that's a pretty big difference if we're looking at like injuries to different things, right? There's all sorts of interesting stuff where like there's neurons coming out of your neck, right? And they're your brachial plexus, which you're going to hate or love when you get to med school, but you're going to have strong feelings about it one way or the other. But like you can kind of like pull and stretch the neck too much, and that can kind of like change things. And so knowing if stuff is preganglionic or postganglionic, where you're damaging that tells you a lot about like, okay, what are the odds of outcomes? What are the therapies? Are the therapies going to be useful? Are the therapies going to be useless? Should we be doing this or should we be doing something else? Comes to kind of understanding this stuff. And there's a weird thing here with the parasympathetic and sympathetic where the neurons going from the spinal cord to the target, that's going to be the postganglionic neuron in the sympathetic system, but it's going to be the preganglionic neuron in the parasympathetic system. And so that's something that you really want to make sure you understand, because the MCAT likes to test those little things. The MCAT also loves to throw curveballs. And those of you who just try to memorize like peripheral neurons, like any neuron outside the spinal cord is a peripheral neuron. Not really. For the parasympathetic system, there's a neuron that goes from the spinal cord and out that is still a central nervous system neuron. Yeah. And so that's something you want to make sure you understand. Don't memorize that acetylcholine is always like parasympathetic. Like memorizing those rules and not understanding how the stuff works, like that leads to missing questions because the MCAT throws curveballs. It also means you're not likely to remember it for very long. I know if somebody told me to just like memorize a whole bunch of things, I'm not going to remember that long term, versus if they teach me like, oh, this is why, like I was able to reattach the arm of that boy, like who got his arm bit off by a shark. And that's why he like regained ability. Like that's way more interesting. And that sort of thing sticks with you long term. And so even though that occurred like 15, 20 years ago, I still think about it sometimes because that's like a pretty cool thing. And like that uncle, like I said, should get an award of like the world's coolest uncle. I beat up a shark for my nephew. Yeah.
One kind of quick last thought on this before we start wrapping up. We are talking about the neurons and that some of them are in the central nervous system. There are other components of the central nervous system that control these responses. So you have probably heard of, and if you have not heard of it, this is your introduction to it. You need to know it for the MCAT. The amygdala in the brain, right? Part of the central nervous system is in part controls our fear response, right? And our emotional regulation, detection of threats. And so if you think about it, it's also going to have an influence on the sympathetic nervous system. But to be very clear, that's part of the central nervous system, not the peripheral nervous system. So understanding the relationship between components of the central nervous system beyond just, for example, the spinal cord can be really helpful in piecing things together. Because again, this is a great connecting point. It can tie in with, this, our fight or flight response is also regulated by hormones, right? We have that connection with physics. We have the connection with, obviously, biochem, with psych-soc, and kind of along those lines. So moving on to our last thought, there are going to be connections to the psych-soc beyond just the actual nervous system, like proper itself. So if you remember way back when we talked about emotions when we were doing the psych-soc outline, and in case you didn't know, we covered a lot of topics from the psych-soc outline at the beginning of the podcast. You can go binge watch those at your leisure. But if you think about this idea of stressors and this idea of our fight or flight sympathetic nervous system being activated, right? it's helpful to understand the general adaptation syndrome and the idea of when your fight or flight, right, your sympathetic nervous system is first activated, you need to respond. And so your resistance to the stress is kind of low because you need to have that response. Whereas once it's been activated a little longer, the body's going to have this coping mechanism where you enter this resistance phase, but you can't do that forever. And so your reserve gets depleted and you end up entering this exhaustion phase. But notice how just recognizing that when your sympathetic nervous system is first activated, it can help us understand why the stress resistance is lower. And so we encourage you guys to try and make those connecting points. We talk about the importance of connecting these different ideas on the podcast so much because it is important. But how do you do that on your own when we're not the ones constantly making the connections for you? Write it down. Yeah. Just sit down with a topic and say, okay, what could they possibly ask me about? I know other topics that I need to know for the MCAT. Which ones relate? And this is where having the study guides that we have mentioned in the past can also be really helpful. And so we encourage you guys to do that for different topics. And I had a student ask me the other day, so I've made these study guides. I know what connects, but how do I study it? Right? Because it's a lot. Study them in clusters. So when you know that, you can connect the nervous system from biochem to just like electrochemistry, right? Or stress responses and emotion and the different ideas of how we process emotion, right? And respond. Study them together in clusters. Yeah. And that can also be helpful for remembering the connections and the relationships that the MCAT could test you on.
Yeah, there's so much there. That's also why whenever a student is like starting a study schedule, a lot of times students say I'm going to do physics first and then bio and then biochem. No, don't do that because you need to be making these connections. So you want to kind of do one chapter from each this week
integration
and go through all of it. That way you're kind of mixing your topics because it helps you make those connections. One kind of connecting thing on this, we have not really talked today about cortisol, and cortisol is absolutely a big part of stress and dealing with that. Also is epi and norepi. But there's a difference between acute stress, which is I'm fighting a bear, and chronic stress, which is I'm being bullied at school and I'm struggling with my classes, but I also might be getting evicted because I haven't paid my rent in 3 months. And that's a different kind of stress than bear, right? And so those chronic stressors tend to be more cortisol related. The acute stressors tend to be more epi and norepi. But this general adaptation syndrome, which is I talked about, I always like thinking about scenarios and trying to understand what this actually means. Imagine a scenario where you're the ER physician, right, for a clinic, and all of a sudden you get a call in 6 busloads of nuns just ran into 6 busloads of children, right, and they're all coming here, and that's what's going to happen is first off you're going to be what do I do, right? And so the stress might get to you a little bit at that first thing. Your resistance to stress is going to be low, but then all of a sudden they come in and you're just in gear. You're a machine. You're going through this and you're doing all the things that you need to do. And you have pretty high resistance to the stress of the scenario and you're accomplishing things after this initial shock. But, if there's 400 people that need assistance, if you can't stay in that, I'm a machine churning through this, you can't stay in that mode for 48 hours, right? Eventually you're going to crash. I just can't do anymore. I'm at the end of my rope here. I actually think that this happens kind of frequently in medicine, where there are things all of a sudden everyone's being pushed so hard, and this exhaustion phase can occur. But I think it's important to understand that doesn't mean that you're failing. That just means you've been pushed so hard. Yeah. And so this is something to take into account and realize this is a biological thing that we're kind of understanding here. That this happens a lot with surgeons and ER physicians and fields like that, where you can just get slammed with a bunch of emergency stuff out of nowhere.
And this can also happen with y'all when you're studying for the MCAT and you have life going on. Life does not stop when studying for the MCAT. And so recognizing when you're switching from this resistance to this exhaustion phase is important. We don't want you guys burning out. We've talked about this so much because that's counterproductive to doing well on the MCAT. And so we encourage you guys, listen to your body, listen to your mind, right? Build in that day off in your study schedule every week and make good use of the resources available to you. In case you didn't know, in case you've only found our podcast and don't know about all of the other resources we have at Jack Westin, go to our homepage and you'll see so many resources on the left-hand side on the actual page itself. And our academic advisors are a fantastic resource to help orient you to the resources that we have. So we encourage you guys to do that. And that way you can be efficient about your MCAT studying so you don't end up in this exhaustion phase faster or more often than you need to.